Hey there, welcome back to Move with Joe. In today's video, we're going to be looking at the secrets to lifelong healthy hips. Now we're going to break it down, we're going to go through a little bit of anatomy, we're going to do a movement lesson, but I'll cue you in on the main focus that I want you to be thinking about through the lesson. And that's whether or not the force that goes through your hip shears across your hip, or if it comes up and through your skeleton. And the best way to begin to understand this is to actually do this movement lesson. So it's a little bit of longer lessons, about 21 minutes. But the people who will really benefit from this are people that struggle with any type of low back pain, or they tend to have a lot of lateral shift movement in their hips. And oftentimes that's because we're not finding that clear skeletal support up and through the hip. So if you want lifelong healthy hips, if you're an athlete, if you're a person that's doing a lot of repetitive movement, or if you're a person that just has some hip pain when you're walking, this video is for you. So let's hop into the lesson. And I got my buddy Stan here, and Stan lost his left lower leg, but that's okay, because we don't actually need his lower leg for this demo. But what we are going to be talking about today are finding the tops of the femurs in the hip socket. So you can see here, Stan is giving us a lovely X-ray view. And oftentimes people don't actually know where their hips are. So point to the point where you believe your hip socket is. So I'll give you a second. And for a lot of people, they tend to point out here. And when they point out here, they're pointing to their greater trochanter, which is this big bony knob on the outside. But really, the center of the hip is much deeper. And so a couple reference points, you could find the front of your ASIS here and palpate that. And then if you kind of move in just a ½ inch or so and then come down, you'll come to the acetabulum where the top of the hip is, where the femur attaches. The other reference point is you can, from your belly button, scroll down until you hit your pubic bone. And again, if you then traverse to the right or left, you'll come to a crease here where you have your hip bone. In today's lesson, we're going to just do some exploration to get a better sense of when we are on top of our hips and when we fall off of our hips. So what I would like for everybody to do is just come up to standing, take a moment and just begin to sense where it is that you find the most support through your legs. So which leg, which hip feels like it's more directly underneath you. So you can just take a moment. If you want to shift back and forth a little bit, you can. You can also begin to bring your attention down into your feet and just notice what part of your feet are supporting you more. Do you tend to have more weight shifted forward towards the ball of your feet? Do you tend to be shifted a little bit back towards your heels? Or do you have a sense that you're coming down more through the ankle joint? You can also think about whether or not you have more weight laterally on the outside of your lateral arch, or if you have more weight coming down towards the big toe on the inside. So we can start to gauge where it is that we find the support from the ground coming back up and through our skeleton. So what I'll have you begin to do is just notice if you're going to come to balance on one leg, which leg would you come to? So go ahead and do that. Shift over. And notice as you shift, how is it to come onto this leg? You can notice where the weight wobbles in your feet. Where do you press more in? Do you press more into your big toe? Do you find the weight more towards the lateral part? Good. You can come back down. And then go ahead and shift your weight onto the right leg, or the opposite leg. Good. And then come back down. So go ahead and just begin to shift back and forth, and notice as you're shifting back and forth, which hip, as you go on to, let's say, your left hip, how far laterally do you have to shift over to come to the point that you are able to stand on just that left leg? And how does that compare to the amount of distance that you have to travel to come onto your right leg? So oftentimes people will find that for one hip, they can find that support fairly immediately. And then maybe another one, you have to swing quite a bit farther over to then come up onto that hip. And notice as you shift your weight, do you tend to sink into your hip? Or is there a sense of coming up over your hip? So as you're shifting back and forth, which leg feels more stable? Now they both might feel unstable and you might be having a lot of quivering back and forth, trying to find that support through the ankle up through the whole leg. But just notice if there's one that feels a little bit more stable than the other. Notice which one you feel taller on. And then you can also begin to notice as you come onto the leg, is there any other types of rotation or flexion forward or maybe a little extension back to come onto that leg? So what other planes of movement besides just a pure lateral shift do you use to find that balance point? All right, excellent. So now, if you want to grab a chair for a little extra support, that's great. Like a regular kitchen chair with a little back would be perfect. I don't have one at the office, so I'm just going to use the stool here. And we're going to begin to explore finding the top of our right hip. So what I'll have you do is begin to shift from both feet so that you start to take your weight onto the right hip, but have this sense of lengthening. So you could imagine that as soon as you begin to transfer your weight right, there's this upward force coming up and through the left foot until the point that you feel like you've gotten to the highest point over the right hip. And then you can bring your left leg back, slide it back a little bit. Your toes can still be on the floor. And now imagine that there's a stick, imaginary stick, connecting from the back of your head down to your left heel. So this whole line is going to remain rigid, and you're going to begin to tilt forward on your right femur so that the head comes forward and the leg goes back. And then as you come, the torso comes back, you're going to bring your leg forward. And you can use your chair for support. And don't use it as a crutch. Use it as the minimal amount of necessary pressure that you need. So if you can use your hand, the whole hand if you need that. But if you only need a couple fingertips, that's fine. And so you begin to come over top of the right femur, the femoral head, and you're going back and forth. And oftentimes you'll hear this exercise referred to as bird dogs. You can think of those little water toys where the head comes forward into like a bucket of water and dips down and then comes back up. So that's essentially what we're doing. But what it's beginning to do is starting to find this clear sensory support from the floor up and through this leg to the highest point possible through this hip. All right, good. Let that shake out. Oftentimes people will start to feel their abductors, all these lateral hip stabilizers engaging. And what I'll have you do is, again, just shift over onto the right hip to the point where you feel you're at the highest point, and then just begin to swing your left leg forward and back. Not too far. If you go too far, you'll start swinging from your back, extending your back. We just want movement from the hip. So you begin to notice where it is that the leg actually begins to swing in the hip socket. Good. All right, give that a break. And just take a couple steps forward, a couple steps back. And you can just sense what, if any, changes you might notice in the sense of where your hip is, the leg swing. And then come back to your chair. And this time, we're going to again transfer the weight up and onto the right hip. You can use your chair for support. Begin to bring your left leg out to the left. And then from here, begin to side bend your torso to the right, and the left leg comes up into the air. And again, you're just using minimal support from the chair. So you can see how clear, how can you maintain that horizontal movement so that you're not getting any type of rotation forward or back, but just trying to maintain this pure plane of movement coming up and over the right femur and back down. All right, great. Okay, so shake that out a little bit. And take a moment here standing and just notice what you sense in terms of your overall support through your legs now. Just see if anything shifted for you in terms of where the weight is in your feet. All right, so we're going to switch over to the other side here. Start with weight in both feet. Slowly shift your weight over onto the left hip until you find the highest point on the left hip. And then go ahead and just swing the right leg back and forth like a pendulum. If you want to use your chair for support, you can. So you get just a sense of the leg swinging in the hip socket. All right. Good, let that rest. And let's just explore a little bit more with this left hip. So try a couple different variations of how you shift your weight over. So for example, as I come over this time, I might sink into my hip. So there's this kind of lateral downward shift. And this might actually feel quite familiar for some of you, particularly when you're walking. You might notice that there's this little hip shift in the back. Many of the habits that we have in our day-to-day movement, whether it's walking or in just chatting with friends, we have these patterns of falling into our hip. So every time we fall into our hip, there's this lateral shearing force that grows across the hip. And ideally, what we want is for any type of force coming through our body, it comes from the ground up and through ourselves and not going laterally across any particular joint. And I'll show you what happens here. So if I were to take a step and I fell into my hip here, you can see that there's this lateral shearing that goes across my back. And that's exactly what we want to avoid, because over time, each time I take a step, I'm getting this collapse into my hip. It's compressing my hip. And that's just creating more compression, wear and tear in the joint. So these movements, yeah, they're great for working with balance, they're great for neurological re-education, but really what it comes down to is finding the best skeletal support so that you maintain a clear sense of transfer of force with all your movements, that you're coming away from the ground in a sense that the ground reaction force comes up and through the skeleton so that we're not getting this lateral shearing in the hips. So that's ultimately what's going to keep the hip healthy. All right, so I digressed. Back to our lesson. So as we shift the weight, so we'll just sink into the hip a couple times, notice what that's like, and you can get a sense. You can actually probably see that as I fall into this hip, my head comes closer to the floor. So let's try another one where we don't necessarily fall into the hip, but we maybe rotate a little bit to come up over onto this hip. So the right pelvis comes a little forward. And maybe the next one we just come laterally pretty far over, so we go way out onto the lateral arch, maybe to the point of tipping over a little bit. So now just find where is that clearest sense of summoning the hip for yourself. You can use your chair for support. And as you're coming across, again, thinking about lengthening out of the right foot, it's like you're peeling your heel off, then the forefoot, and then the pinky toe all the way up to the big toe to the highest point. Then the leg can come off. And then from here, slide the right leg back. Begin to tilt, have the imaginary stick from the back of your head down to your right heel. You can begin to tilt forward using your chair for support. And then tilt your upper body back, your head comes forward, or sorry, your leg comes forward. And notice how free is your breath as you make this movement. When is it that you notice that you begin to hold your breath? How free is your neck to move back and forth? It's not the easiest time to be moving the head and neck because there's a fair amount of stabilization at this point. And if you want to try without the hand, you can. Notice where you find the most support through your foot. Great. Okay. Give it a rest. Go ahead and take a few steps forward. Notice what it's like to walk forward now. Take a few steps back. Come back up to your chair. Again, shift, lengthening up over your left hip. Find the summit of the hip. And this time begin to take the right leg out to the right and your torso to the left. Using the bare minimum of support from the chair with your arm. You don't want to be pressing into it because what we really want to focus on is finding that clearest sense of maintaining that length through the hip, staying on top of the, summoning the hip. All right, good. Come on down and just take a moment to sense the support of the legs now. Notice where the weight distribution is in the feet and just sense if there's anything that's shifted. So maybe if you were a little bit farther back, you feel like you're maybe more centered over your ankle joint, or maybe in the beginning you had some more weight in the front and you're a little bit more centered over your ankles. Notice the weight distribution side to side. And just think about when you were balancing. Was it easier to balance when the weight was towards the big toe or a little bit more towards the lateral arch? And go ahead and shift onto one leg. And notice, is it the same leg that you originally picked? Come up to balance on it. Notice what the quality is like now. Come back down. Go ahead and shift up to the highest point on the opposite hip. Have a sense of clear skeletal support through this hip. Come on back down. Take a step forward on one leg. Come back. Do that one again. Come back. And then try the other leg. Come back, and one more time on the other leg. All right, so most people at this point would feel that they have a more clear sense of being on top of their hip. This lesson is really focused on having you experience all these positions on the hip. So instead of shifting into the hip this way as I come onto my leg and creating this compression here, what we want is to maintain ourselves over the very top of the hip. So the biggest tip for lifelong healthy hips is really understanding clear skeletal support so that you maintain moving through the highest point of the hip and not shearing and collapsing into your hips. And you see this in sports. Hockey is a great example where there's a lot of hockey players that end up with torn labrums. And that's because when they go to push off on their skate, they're actually collapsing into their hip and then pushing off of a collapsed hip. Whereas if they were able to maintain a little bit more open hip here and be able to skate off of that, that would create a more organized way of moving through the hip. And it's the same thing when we're walking. If I'm shearing into my hip and my weight is collapsing into the hip, it's compressing the joint and putting more compaction into the joint. Whereas if I step in a way where I'm finding the very top of my hip, that weight, that ground reaction force that's coming back up and through my body is coming up and through it, all the way out through the top of the spine, versus any of that shearing force that occurs from the collapse into the hip. So that's it for the tip of the day on healthy hips. I hope you enjoyed the video. Please hit the like and subscribe button, leave a comment, ask a question, and I'll see you next time.